Millions of women went without getting treatment for their menopause symptoms. Hey folks, Dr. Grossgold here, GBR Plastic Surgery, board certified urologist. Removal of the FDA black box warning on menopausal hormone therapy happened in November of last year. This is a big deal. What is a black box warning from the FDA? The FDA looks at the risks and benefits of a certain intervention or treatment, and they say that outweigh the benefits, so they're going to put a warning on the label saying that you should really be careful about using it. Does that mean you can't use it? No. Why was there this black box warning on menopause hormone therapy? And that was almost 2 decades ago. It's based on a flawed study. Flawed study which you may have heard of called the Women's Health Initiative, and that came out in 2003. Now know that it was a flawed study. We didn't know at the time, and so that's what caused this problem with the black box warning. And that had some significant downstream effects. That's a tragedy because these women suffered for so many years and they didn't have to. What did they do? The FDA recently removed the warnings for cardiovascular disease risk, for dementia risk, for breast cancer risk, and that was important because those are the things that kept women away from menopause treatment. What they did keep was the risk of endometrial cancer if you're treated with estrogen alone and if you still have a uterus. We recommend that women get the hormone therapy within about 10 years of onset of symptoms of menopause or less than 60. If you're outside of those boundaries, you can't get menopause treatment? No. This means that we need to have that discussion. There are some other things to consider. It created 2 decades of fear and misinformation and kept all these women from getting the treatment that they needed. Now we know that it is safe. And women and their doctors are able to make these decisions based on data and not on fear. There have been trials since that Women's Health Initiative that have shown that menopause hormone treatment decreases your overall mortality risk, decreases your risk of cardiovascular disease, decreases your risk of bone fracture by 50 to 60%, decreases your risk of Alzheimer's by 35%, and decreases your risk of overall cognitive decline by about 65%. So there was a meta-analysis which over 26,000 women in the study that showed that there was no increased risk of cancer mortality for menopause hormone therapy. That's a huge deal because that's what caused all of this fear about, am I going to get breast cancer for starting estrogen? And the answer is no, you're not. In fact, it's going to improve your mortality rate.